Hello, everybody. Welcome back to our podcast, Ageless Anatomy Podcast. My name is Darcy. I am one of the certified laser technicians here at Ageless Anatomy.
And I am Brooke. I am also a certified laser technician as well as trainer and partner at Ageless Anatomy.
And I'm Dr. Cain. I'm a board-certified naturopathic medical doctor and a partner at Ageless Anatomy as well.
And we are talking about acne today.
Gotta love acne.
Yeah, no.
Yeah, something that unfortunately affects a lot of people.
40% worldwide.
40%.
To be not exact. I mean, it could have changed a little bit, but I can remember back when I was younger, and I'm in my 50s now. When, as far as adolescent-wise, because it does affect, it can affect you your entire lifetime.
I think I still suffer from the occasional breakout, whether it be hormonal or just, acne.
And I think when you bring up hormonal, I think we're really fortunate to have Dr. Cain here, because not every esthetician, as well as laser technician and skin specialist, has access to someone like her in their practice or med spa or whatever it is, where she can actually, there's testing now, whether it be she's testing hormones or, you can go on about that, because any lab work and what you find in it.
Well, the difficult thing about acne in general is that it has so many different etiologies. So what will cause acne in one person will not cause acne in somebody else. And the reasons that acne pops up can be, it can be food sensitivities, it can be hormones, it can be toxin overload. Excuse me. It can be stress, it can be nutrient deficiencies. There's so many different things. And so, being able to have specialty tests to evaluate that can really help us drill down to treatment. I'm sorry, I'm dying over here.
Yeah, I think my kids have all been affected. Not all of them, but a couple of them have been affected by it. And it's an awful thing for kids to have to go through. So the testing now that you said is available is good to try to, and I think there's a test that we do in the office that can kind of pinpoint where it's coming from, correct? Or where it's originating from. Sorry.
So what we can determine is if they've got a hormonal imbalance that's causing acne, or if they've got food sensitivities that are causing acne, if in general they've got a lot of GI inflammation, or if they've got some kind of toxin overload. We can test for those things. But what's really interesting is now we can test genetics to determine what treatment will be effective. So that's really where we can be individualized with acne care, because we can do a test that will tell us what the patient will respond to as far as treatment goes. Mm-hmm. So then we have a guidebook there. I think there's also, in general, acne is caused by the overgrowth of a bacteria that naturally occurs in the skin. But what condition allows that bacteria to overgrow can be different. So if we can treat that underlying cause to prevent it from returning, oftentimes the flare can be treated, superficially as well with topical medications, supplements, or even laser, right? So laser can be really beneficial for calming things down and getting us to baseline, and then using some of those treatments based on testing to prevent it from coming back.
Right. I think one of the treatments, we talk about utilizing chemical peels and the BBL Forever Clear, which is by Cyton, the broadband light and the different wavelengths, as well as I've used non-ablative halo and ablative halo. The BBL Forever Clear is my favorite when you talk about, maintaining that, changing that tissue underneath so that we can bring down, with the 420 nanometer, which we use in the first couple passes of that, is it kills P bacterias, and it's a great, it's on the violet spectrum. So we'll utilize that first, because some of that, when it starts, it can really start spreading, and then you have it inside the hair follicles, and it really keeps going. So that works really well. And then our next pass, you talk about inflammation in there, and that's where the 560 comes in. It's typically a vascular, hits in the vascular area of the whole spectrum, the 560 nanometer, and helps you calm down that inflammation and redness. And then we are going a little bit deeper using the 590 nanometer that gives you that depth and helps with that cell renewal. 560 helps with that as well, but it's nice because it starts creating that new tissue growth underneath there while it's healing everything. And I think that the Cyton, I feel that the Cyton is Forever Clear is by far, outweighs some believe in the peels, unless it's just the bacteria for peels. Chemical peels, we use salicylic, and but I've had great success with the BBL Forever Clear. It's a little bit spendier treatment. It takes a little bit more, having patients come in 1 to 2 times a week. But that's where I feel it's great to have you to be able to test that stuff, because if it's something else, or if it's just hormonal, it doesn't always stay. And so then you have clients that are spending astronomical amounts of money, when it's nice for them to be able to test first so that you can see. I know it helps the tissue underneath. It's not just for bacteria, but it gives us an idea of where to really start.
Yeah, I think that's the key, is knowing what's causing it and addressing that. However, I think that people underutilize laser for acne. They go to a dermatologist, and the go-to treatment is Accutane, which is a nasty drug. And if you've got a younger person who's still in their reproductive years, you don't want to be introducing that toxin if you can avoid it. And so I think acne can be treated with so many other modalities that Accutane should never be the go-to. I think it should be kind of a last resort. And so even if you're going to spend, more money getting laser done, it's safer, it's healthier, and in combination with testing, we can actually get to the root cause. Accutane's not treating the root cause. It's another Band-Aid. And I've actually seen people who got, had Accutane and ended up with acne again. Because again, they're not treating what's actually causing it. So I think it's worth spending the money to not expose yourself to, such a toxic medication.
Yeah.
True.
And there's also different types of acne too. Acne can be in the form of folliculitis. It can be as rosacea. It can come in all kinds of different forms. And treatments differ depending on what kind of acne. So you really have to get an accurate diagnosis as well.
It's true. When I worked with dermatologists, the rosacea, where you have the pustules, and even, from one range to the other, actually, there's all different that comes along with rosacea, and their go-to was mainly a topical that just kind of calmed it down, but it really didn't
treat it.
Yeah, it really didn't treat the whole thing. And laser does. There are a lot of different that we have for vascular rosacea, and some of that it's painful. It's sensitive. So it's rough going through it a little bit, but it's worth it. We've had some great results.
Well, rosacea is a form of acne that will respond really well to lifestyle changes. I mean, avoiding heat and alcohol, caffeine, drinking enough water, taking your vitamins. I mean, just these basic things can help to really reduce the appearance and flare of rosacea.
And that's something one has usually. It's not really curable, correct? Is it just treatable?
It can be corrected to the point where it's
You won't have flare
Maintain.
not obvious. Yeah. Yeah.
So, okay, so that's another, going off of that, talking about lifestyle and acne. With a lot of energy drinks and, there's medications that I know, antidepressants, some of them can really cause acne even in adulthood. I mean, let's start with lifestyle then. I don't think that people realize, because they didn't have acne when they maybe started drinking energy, let's just take energy drinks or something. And then it came later on, so they don't realize that that's what it was. Does it take time for that to just keep beating your system up with it and then it just starts? Or how does it? I hear a lot of clients say, well, and dairy. I've always had dairy, it's fine. But then if they cut back and then it clears up and they're like, I don't understand, I never had acne when I had dairy before.
Mm-hmm. Yeah, so it's a great question. So the most common sensitivities that I see in people with acne is sugar and dairy. And the reason that it doesn't always flare up the first time you have dairy is because it's an insult to your GI that takes time, right? Your GI is pretty resilient, but if you just keep exposing it to these sensitivities, these food sensitivities, and like I said, most commonly are dairy and sugar for acne patients, eventually you get to a point where you start to break down the lining of your GI and your immune system starts to mount a response. And that can manifest in a number of different ways. But oftentimes it's a skin condition that we'll see first. And it could just be a rash or it may actually be acne. But it takes time for that GI barrier to get compromised and for it to then show up.
I mean, I think, so adolescents, when we talk about adolescents that have acne, I think it's something like 40% it starts now between ages 8 and 9. Like, that's young.
Mm-hmm.
When I was growing up, we never saw that. Even getting into high school, there were maybe 3 to 5 kids with acne, and it was so odd to see that sometimes they were actually really bullied about it because people, you just didn't see that on people. And now they say it's at 40% for females and I think 35% in males. From 14 to 16, females are higher, and then males 16 to 19, they don't start until age 16 to 19, and they're still like around 35%.
So there are a number of factors that are influencing that particular age bracket. One is that those kids love to eat trash. Let's be real. Their go-to is candy and chips and crap food, right? They eat a lot of processed garbage, and it's just full of chemicals. You want to talk about energy drinks. That's another thing that can cause acne because it's just all chemicals. And in fact, there's
sugar, right?
There's elements added to energy drinks to aid your liver's ability to detox because they're so full of toxic.
I didn't realize that. Well,
ingredients.
how would I know that?
I remember when we did Janae's blood work a while ago. She was probably 16. And Dr. Cain came and said, hey, does Janae drink alcohol a lot? And I'm like, gosh, I hope not. I think she was 18. I'm like, I don't think so, but I don't know. Let me ask her. And Janae's like, no, I don't drink ever. Next question I think you asked was, does she drink energy drinks? She was going to Dutch Bros daily to get those energy drinks that they have, and it was affecting her liver and the enzymes in her liver. Yeah, it was affecting her liver.
Yeah, they're full.
Made her look like she was an alcoholic almost.
Yeah, they're full of toxic compounds.
I remember when you were talking about her liver and trying to get it back on track and everything, but I didn't realize that's what it was.
She was drinking Dutch Bros every single day, sometimes twice a day.
Yeah. So those companies are actually forced to put certain nutrients back in their drink to help
Bad.
aid liver detox pathways because they're so bad for you. That's one thing. And then the other
Scary.
thing is, adolescents are in that, not only are they being exposed to a lot of hormones in their environment, in their food, in their water, but also a lot of chemicals that disrupt their endocrine system. And then they're going through puberty, right? So we're compounding all these different factors. They're probably not taking a multivitamin. They're probably not drinking enough water. And they're probably not getting enough sleep. I mean, there's just so many things that influence that particular group. It's like a triple, quadruple whammy for their skin. And skincare. Skincare is the other thing. I mean, we know that teenagers are not great about skincare, or their parents are buying them something just, at Walgreens or whatever that's drying their skin out and just making the problem worse. It's just a vicious cycle, right?
And I think sun exposure too. A lot of my girls, they love to lay out in the sun, and I think that's horrible for your skin and can cause acne. So there's a lot of things that are just bad these days for kids.
Okay, so I didn't have acne, but this is what's coming, what I'm thinking right now, is when you talk about hormones, at one point you said that my body doesn't detox hormones well, or, and so you had put me on a supplement. So if these hormones that are induced by foods and things like that, is there any way to detox them? What do they do then with the environment and all of this stuff?
Yeah, so what you're talking about is a little bit different. What we did with you is a genetic test to see how you metabolize different hormones based on your genetics, and that's always an option for people. What I'm talking about is hormones that come from our food, primarily in meat and dairy and any animal products. These animals that are raised conventionally are just pumped full of estrogens and all kinds, and then of course we eat it, or we drink it, or whatever, and so we're just getting massive doses. So primarily, you just have to make good selections at the grocery store.
And just avoid all of it.
Yeah, you've got to avoid things that are not raised hormone-free. I mean, and like I said, it's mostly animal product. But the other thing is processed food. There's so many chemicals in processed food that disrupt your endocrine system, that can cause your body to either produce too much or too little hormone. Avoiding highly processed foods is important too. Not eating a bunch of fast food, making sure that you're avoiding plastics, and these are things that are partly parents are responsible for too, because they have to help their kids to learn and to know what's safe and what's not. And I think that's part of the problem too, is a lot of the general public just isn't aware of this stuff, and so they don't teach it to their kids and their teenagers. But that's really the best way to avoid it, is to live a cleaner lifestyle.
Wow.
Which is hard because, teenagers, they want to eat what's
I think
fun to eat.
Parents also do it because it's easier, it's quicker. They just grab
It's
something to eat on the way home.
and their friends are doing it,
Yeah.
right? There's some of that going on too. This, need to be accepted and part of the group and doing what everybody else is doing. And you don't want to be that weird kid that's like, oh, I can't have that because it might have xenoestrogens in it,
Right. Right.
So I get it, but you have to just do what you can and make changes where it fits your lifestyle and do the best that you possibly can.
Well, and I think there are so many different products and things that have come out now, even the colas or sodas and things like that. Decades ago, there just were not all of these. I mean, energy drinks didn't exist.
Right.
And
well, we were just talking about this before we even started on the podcast, right? You had a can of water, right?
Yeah.
And we were just talking about even the lining
what's
of cans.
of it.
I didn't
realize it.
Right. That's just water, right? Purified water with electrolytes sounds great, but the lining of the can contains toxins that are bad for your hormones.
I mean, how does a person even know all of this unless, we sit with her every day.
Yeah.
You don't. And that's what's sad. We just have to do our best to educate people. And, the more that we can expose people to the information, the better. And I think a lot of people are catching on.
So let me finish this can.
I was just saying, that's why Dr. Cain drinks out of her glass jar every day.
The glass jar that she's had for 15 years.
Yeah.
I know you've had that for 15 or something.
Probably. Yeah, probably. Anyways, yeah. But we could also talk about just skincare too. I mean, what people are putting on their face. I mean, there's a lot of crap in skincare too. If you're not using a good product,
or if they're
even washing their face.
Yeah.
So there are good skincare lines to help with acne.
And I think, even like you had mentioned, people that are stripping their barrier, there's a reason why we carry Elastin and Skin Medica in there. There is the one product that is from Skin Medica that's so different as well, that it treats hormonal acne.
Yeah.
And I personally believe that it's because it does dermal repair. It goes deeper, it gets up underneath it. It's not, like you said, just completely drying out the surface.
I was just going to say, it's actually one of the products that doesn't dry your skin out.
Yeah.
Which I think causes more acne.
People think they need to dry their skin out, right? Because they think that it's coming from the oil in their skin. Right. No, the oil is a response to damage. Like, that's your skin's way of responding to damage, is produce more oil. But if you just continue to strip it down, it's just a vicious cycle. Yeah.
Yeah, it's like kinking a hose instead of just letting it go, right? And then the Elastin products, they don't have things that they're specifically for acne, but it's repairing the whole tissue as a whole. So when you think about even fine lines, wrinkles, and any sort of damage, acne's the same. You're correcting underneath.
And you're using the product to teach your skin how to act, right? Like, the products retrain your tissue. They retrain all of the fibroblasts, all of the different immune cells. Everything that's going on in your skin is trained to function optimally when you're using a good skincare product.
Right. And, like she said, it's the same with laser. Retraining it, not just putting a Band-Aid on it.
Right.
Not just putting a little pimple patch on it.
Pimple patch. Right. And then a good shot to your liver with some Accutane.
Yeah. Okay, so tell me this, speaking of Accutane. So the vitamin A. We, for a long time, you still do, you will put patients on certain doses of vitamin A. And how does that work with?
Yep. So supplementing vitamin A basically works as similar to the way like retinol works. Only you're ingesting the vitamin A, and your skin takes that vitamin A and turns it into a retinol-like compound.
Okay.
And it's a much safer way. Accutane is kind of a version of that, but it's a toxic version. Whereas just supplementing regular vitamin A, which we're using very high doses, and I wouldn't recommend using for prolonged periods of time, but it's a lot safer than doing something like Accutane. And there's some limitation to it too. Like, you wouldn't want to get pregnant while you're using high doses of vitamin A, but these are things that we would educate patients about. But it does work very well in combination with vitamin E. You also want to use high doses of vitamin E together. And it really helps to reduce acne.
Do you think someone, though, that has severe acne could get the same results that Accutane would give them, that vitamin A and vitamin E could give them?
Not alone, but in combination with testing to determine why you've got acne, treatment, probably testing to determine what you'll respond to based on your genetics, and laser. It would be a more intense protocol for somebody with severe acne. But again, it would be worth a shot. I would leave Accutane on the back burner until you have to use it.
Yeah. And this testing, a lot of this testing's new. She's always tested hormones and things like that, but there's a new testing out that...
The realm of genetics and epigenetic testing has really exploded. And we can really use it now to determine, based on your makeup, what your body will respond to. Even when it comes to things like hair loss, we can determine what treatments your body will respond to. So not everybody will respond to something like minoxidil, for example, that's, prostaglandin that makes your hair grow. if you're not genetically wired to respond to that drug, then you could take it all day and your hair won't change.
That's interesting.
But you might be somebody that really responds well to like finasteride or zinc or, something else. And so if we can test that and we know, then we can really individualize care.
Right.
Yeah, that's nice, because then you wouldn't have to go down the line of trying every single.
Yeah. And we have that same test for
medication.
acne. We have that same test for acne.
And that's, I mean, really, that's why you hear people say, I wish they would have had that when I was younger.
Right.
It's kind of the same with lasers and things.
Right.
I wish they would have had all this stuff when I was a little bit younger so I could have started earlier.
Yeah.
Not just with acne, but, aging and things like that.
Yeah.
So it's
always changing. Things are always changing. We're always learning. And we're also learning a lot about how to repurpose old drugs that have been around forever that we didn't know could do certain things. So, it's just thankfully there's people out there that want to dedicate their career to learning more about this stuff, and then they pass it on to us.
Right.
perfect.
Mm-hmm.
Anything else on acne? I mean, I think, okay, so we could talk about, and I'm thinking about Gianna standing over here in the corner who's filming with us and not joining us because she was devastated by her acne. She's my niece, and it's one of the things that got her into this business. Emotionally, I mean, especially when you're a kid, if it starts at 9 years old and even female.
It's awful.
Oh, yeah.
Well,
It's
I mean,
awful.
you're kids, but I mean, I know you're standing over there in the corner, but
Yeah.
I did not have acne. I might have had
A
one
pimple,
pimple, and it was tragic because I would get them like once a year or something, and then it was the biggest thing ever, and so it stood out on clear skin.
Yeah.
But yeah, I mean, it's
Oh,
painful.
it's terribly
It's-
emotionally damaging for especially young people.
Mm-hmm.
I shouldn't say that. I say even for older people when they,
It's awful.
suddenly develop adult onset acne, like that just seems really wrong, right? I
Mhm.
mean, and then that's causes an emotional downward spiral.
Right. And then I think, this is I mean, it could be a whole separate thing, but maybe not. We're talking about acne. Even when it's cleared, some of that scar tissue has still been left behind.
Mm-hmm.
And so you may not see it right away, but that scar tissue continues to pull in, and then you end up with acne scars, which is, Gianna's in the correct business to have that taken care of, but that's what came later on for her.
Mm-hmm.
And as you get older, if it's not corrected with laser, and it just keeps pulling in, and then you have a whole other issue that you're self-conscious about. And I've had grown adults that, yes, their acne's, they haven't had it at all for years, and it just keeps getting deeper like a wrinkle would, a deeper line. And
Mm-hmm.
Yeah, it's a massive, massive problem.
it's not fair.
And it can be overwhelmingly difficult to treat too. I mean, it can take a few attempts at different modalities to address it. But because it has such a big emotional impact, it's worth the work, right? It's worth the work.
Right.
So,
I mean, I have a story. I have a few stories, but when I was teaching, I had a gal that would drive down from Tucson, and I can remember when when I went out to get her in the waiting area, and she walked in and she had her hair all down on the sides, and I treated her. She had scarring. She was in her 50s, and I did a treatment on her. She left. She came back. She came back after 3 months. We did a profractional on her, and she had about 30% clearing after the first one. And her boss ended up deciding that he was going to pay for her treatments because he could see not just how she was,
Her whole demeanor changed.
Mhm.
Yeah.
and she could look at people
Yeah.
and talk to them in the look straight at him instead of looking at the ground. She had worked for this place for, I think, 20 years or something like that.
Was this active acne or scarring?
She
that you
was
were treating?
scarring. And it was pitted, like ice pick, deep scarring. And she, the next times, probably after on treatment 3 when she came in, she had her hair back in a ponytail and her head wasn't down at all. And she, after we finished the treatments, I mean, she was, the last time I saw her, she was probably about 85% smoother with that tissue. And her boss ended up calling and saying, you know, she's worked here for over 20 years. I don't know how many of that was. And I was actually able to promote her because she could lead a team. She could actually have conversations with people. And I knew that she could do it inside, but it was just to send her in front of a team to lead a team. You can't lead a team that way. And it actually, having her face done gave her more money and changed her life, just emotionally, financially, in every way of the probably she wasn't in a relationship at the time. Yeah. But it's, your self-confidence.
Yeah.
So that was one of my success stories. I have a few about acne.
Yeah, it is. You have no confidence. You don't want to look people in the face. You feel like that's all they're staring at when they're looking at you. So it's...
And people really aren't. I don't feel that they are.
Yeah.
I don't, and I work on skin, so I can't imagine. But, you have it in your mind that...
But you have to live with yourself all the time, every day, and what you're telling yourself, right? So that's the problem, is people have just very negative self-talk about acne, and so if we can fix it, that's amazing, right?
Right.
Yeah, I don't think people really know too that they can fix it even after it's all cleared for people who have scarring, that there's laser that can... when's it best to treat acne scarring early on, or have you had people come to you that have had scarring from 20, 30 years ago?
I mean, it's when we start the treatments, it actually starts, so it's working, but it depends. I'd feel comfortable doing halos over that right away. But pro-fractional, sometimes if they're still in active acne, it can purge and spread it. I mean, you really have to be able to control it, and then it just traumatizes them even more. So if we can get it to where with BBL Forever Clears or even peels, if we can get it to the point where it's a little balanced, I think that's the biggest thing, is you don't want to traumatize them even worse. They'll never come back.
As for scarring, like say I had acne back in the day and I didn't realize that you could treat my scarring, would it still be beneficial to them to come in and start doing laser treatments?
Oh, yeah.
To clear those acne pits. Yeah.
That scarring for her, I mean, she had carried it since she was in her 20s.
Yeah.
And it just kept getting deeper. So she was seeing deeper shadows and she couldn't figure it out because she wasn't breaking out anymore. Yeah. And, the box scars are probably the toughest.
Never too late to fix it.
And at that point, she's aging too, so it kind of was a bonus for her.
Right.
I mean, she wasn't old, but you see that aging.
So it's never too late.
Yeah. She referred a lot of people.
I bet she did.
All of her friends at that office.
Yeah.
Her texture was great. Her lines, her scarring was smooth. She looked fabulous.
So that wraps up our talk today about acne. Thank you for joining us. If acne is something that you suffer with, or you know anybody that suffers with it, either young or old, please contact us here at Ageless Anatomy. You can call the office or you can DM us here on Instagram. Have a great day, everybody.